The Auditor General's report has uncovered irregularities at the Ministry of Health in 2015 and 16.
The report has highlighted many irregularities that occurred at the Medical Supplies Division of the Ministry of Health. Incidents where medical drugs were disposed as they are unsuitable for human consumption or harmful to the patients had been reported in the past. During the period between 2014 and 2016 alone, 180 such medical drugs had been disposed. 117 of them had been imported from India, while 10 were imported from Pakistan and 8 were imported from Bangladesh. The most surprising and concerning revelation is the fact that at the time the medicine was deemed unsuitable for human consumption, an amount between 32% to 100% of these stocks of medicine had already been issued to the general public. The report states that these medical drugs unsuitable for human consumption were issued to patients treated for diabetes, epilepsy and chickenpox. These unsuitable medicine were also given to pregnant mothers. Instead of blacklisting the suppliers who procured substandard medicine, officials had continued to import medical drugs from the very same suppliers. The Auditor General's report states that by failing to purchase adequate medicine in advance and opting for emergency purchases, the loss caused to the state during the past 10 years is 5.1 billion rupees. During emergency purchase of medicine, a pill that could have been purchased for a price of 64 cents from the State Pharmaceutical Corporation had been purchased at an exorbitant price of 64 rupees per pill. An injection that would usually cost 1,058 rupees had been purchased at 19,000 rupees each. The audit report also revealed that hospitals had followed a similar approach when purchasing other medical equipment. A pair of surgical gloves which could have been purchased for 35 rupees and 26 cents was purchased by the Castle Street Women's Hospital for 57 rupees and 25 cents. The Auditor General stated that the loss caused by the disposal of unsuitable medicine in 2015 was 234 million rupees, and in 2016 the loss was calculated at 602 million rupees. The Auditor General's reports, released during the past few days, had revealed an array of malpractices at many state institutions. The reports included irregularities during the construction of the Uma Oya project, details of gold being mixed with sand and smuggled overseas, and questionable issues that caused the collapse of the Mithotamulla garbage dump. The general public are well aware of those who line their pockets at the expense of the people through all these scams and malpractices. The general public of this country have to suffer and pay for the sins of corrupt officials and leaders. Should these individuals be allowed to continue looting the country? The time to decide is drawing near.